I'm Laura Magson. I head up the Mesothelioma and Asbestos Disease team at Boys Turner. Many thanks everyone for listening in today. We normally hold our annual Mesothelioma and Lung Cancer Study Day in our office, and it hasn't been possible, of course, to do that face-to-face this year. So instead, we are hosting a series of short webinars. I'm joined today by Lynne Squibb, who runs HASAG, the amazing charity that's dedicated to helping people suffering from asbestos-related diseases and their families. Lynne is also Vice Chair of the Asbestos Victims Support Group Forum. Thank you, Lynne, for agreeing to give us a short presentation today and to carry on. I will let you take over and tell everybody what you're going to talk about today.
Thank you, Laura, and thank you to Boys Turner for allowing me to speak today. It's really good to join you all. So, as Laura said, my name is Lynne Squibb, and I'm from the HASAG, Asbestos Disease Support charity, which was founded back in 2006 after I lost my father to mesothelioma. Our story is that my dad was diagnosed with mesothelioma back in 2005, and he was basically told to go home and get his affairs in order. He wasn't offered chemotherapy, he wasn't offered palliative care, there was no referral to a hospice, and basically we just went back to just see how he was doing from month to month. And during that time, us as a family found the whole experience incredibly isolating. And considering we were in an area where there was an awful lot of asbestos-related disease because he'd worked for the railway works, we couldn't believe that we weren't in contact with anybody at all that had developed not just mesothelioma, but any other type of asbestos-related disease. So he was diagnosed at the beginning of 2005. And during that year, he gradually declined. We pushed for chemotherapy, and then we found out about pemetrexed later in the year. But unfortunately, the trust said that he wasn't eligible for it because we lived in the wrong postcode. So he was unable to receive any chemotherapy and sadly passed away 10 months after diagnosis. And during that 10 months, the only support that we received was in the last week of his life, when we were able to get hospice involved, and we also had Marie Curie to support us. So we went into 2006, obviously devastated at the loss of our father, but my sister and I just felt that we needed to do something positive, proactive, that would enable us to support patients that were diagnosed with any type of asbestos-related disease and not feel the isolation that we did. So we set up HASAG in the beginning of 2006, and our main aim was a focus for the patient and their loved ones, carers, family, just to ensure that they didn't feel the isolation that we did during our previous year of my dad's illness. So the charity was set up, and within the year we registered as a charity. We were just a non-for-profit to begin with, and at the beginning we did coffee mornings to support people, and they were so well attended. We had patients that would come along and they would ask us an awful lot of questions about, am I entitled to this? Where do I go for that? So we decided to train as benefits advisors and to offer home visits so that we could go and see people shortly after diagnosis. So we could sit with them and complete all the benefit forms, not just for them, but for their families, to take a holistic approach so that we could look at the family as a whole and identify what benefits they would need, what they'd be entitled to, and try and get those awarded to them as swiftly as possible. So since then, we've worked incredibly closely with the Department of Work and Pensions, and we meet with them a couple of times a year to iron out any issues that we have, just to enable the patient and their family to receive those benefits as quickly as possible. We also work closely with lung cancer nurse specialists, and now we're lucky enough to have mesothelioma nurse specialists across our region. And in actual fact, we fund 2 mesothelioma nurses with a plan to fund 2 more this coming year. We now support over 90 hospitals across our region. We have quite a big reach. It's pretty much the whole of the south of England, except for Devon and Cornwall. And we're part of a campaigning group, the Asbestos Victim Support Group Forum. And we've been lucky enough to raise over £600,000 in the last 10 years. And that money's gone towards research, and to support Mesothelioma UK and their nurses. We're also part of the UK Mesothelioma Alliance and other organisations which we help fund. So I just mentioned the Asbestos Victim Support Group Forum. So it's an umbrella organisation that all the support groups in the country come together, and we speak as in one voice. And this is on campaigning issues, so we spend some time at Parliament lobbying the government, just to enable anyone that's been affected by asbestos to get the rights and welfare that they are entitled to. And all of these organisations are either non-for-profit or charities with the same ethos as ourselves, but we campaign together. We just feel that if all of the groups come together, it's a louder voice. Our main beliefs are there in front of us, so that we give free, independent and confidential advice to anybody that's diagnosed with an asbestos-related disease and their families, and we'll help them claim benefits and government compensation. That we support families where we offer support groups, and this is included in this is for bereaved families and our supporters. So it's not just for the patients. We walk a patient through from diagnosis right through to sadly passing away, and the coronial system too. And then we campaign on those patients' behalf to make sure that they get access to treatment, research, trials, and fairer compensation. And we raise awareness also of the dangers of asbestos, because as we all know, asbestos is still present in an awful lot of buildings. So we make sure that tradespeople are aware of the dangers of asbestos too. And just there's a screenshot there of all the groups that offer benefits advice. So we're dotted right throughout the UK, sadly not in Northern Ireland. That's something that we're working on. But we're all dotted throughout the UK and try and cover the UK in its entirety. So if we can't offer home visits to people, we would offer the advice over the phone. So at the moment, because of COVID, we're not seeing patients at home, but we're doing all the benefits over the phone or FaceTime or Zoom. It's not quite the same, but it's the best that we can do in the circumstances. So there's just a quick overview there of everything that a patient would be entitled to if they were diagnosed with mesothelioma. So these following slides are based on a mesothelioma diagnosis and not for other types of asbestos-related disease. So if we identify that a patient's exposure to asbestos was in their workplace, we would firstly look at something called Industrial Injuries Disablement Benefit. And that's a weekly benefit that's awarded at £182 a week. And the initial payment is backdated 13 weeks because the government assume that somebody has been suffering from the disease before their diagnosis. There's then a choice of whether or not we claim something called constant attendance allowance, and that's for somebody that really is quite poorly, and that is paid anything between £182 a week and £218.40. Again, that's backdated. If we see somebody that's quite well, then we would claim a benefit called attendance allowance, and that's paid at £89.15 a week, and that's for somebody that's over 65. if we have somebody that's under 65, we would claim a personal independence payment of £151.40. And that's in two components. One is for living and one is for mobility. And then finally, if somebody's had to give up their job because they're now not well enough to continue to work, we would claim an employment and support allowance of £116.80. Coupled along with those benefits, a patient would also be entitled to a lump sum, and the lump sums are anything between £14,578 for somebody that's 77 years or older, and for somebody that's as young as 38, they would receive £93,827. And sadly, we do see people that claim the higher amount because in the last few years it has become more prevalent for people much younger to be diagnosed. So this is the Pneumoconiosis Workers' Compensation Act 1979, and people can claim that if they're in receipt of industrial injuries disablement benefit. For those people, and there are quite a few, that aren't really sure where their exposure was, or if they washed their husband's overalls, or if somebody was self-employed during the time that they were exposed to asbestos. The Asbestos Victim Support Group Forum campaigned, and in 2008 the government then had another Act of Parliament called the 2008 Diffuse Mesothelioma Payment Scheme, and again you're entitled to a lump sum of exactly the same amounts of those that are entitled to industrial injuries disablement benefit. So we ensure that those people that can't identify their exposure or were self-employed, they're entitled to that lump sum too. We also have worked really closely with Mesothelioma UK and Veterans UK so that we can offer a service to patients whose diagnosis is from when they worked in the armed forces. And predominantly we see people that were in the Navy, sometimes in the Army, and also the RAF, where they worked with, or asbestos was in the area in which they worked. And these people would be entitled to something called a war disablement pension, and that sits at around about £185 a week, and there's some additional payments and increments that top that pension up. And that was available, that's still available, but was all that somebody that was in the armed forces would be entitled to up until 2015. And again, we campaigned to the government, and because they were slightly disadvantaged because they didn't have access to any lump sum payments or compensation. So now somebody that worked in the armed forces would be entitled to a lump sum of £140,000, and this is paid out usually between 2 and 4 weeks after the application. But you have to have a choice. You either decide to take the payment or to take the weekly benefit. You can't take both. But these payments are paid out quite swiftly, and our colleague Lisa works very closely to make sure that these payments are sorted out. And when somebody sadly passes away, regardless of whether you're taking the pension or the lump sum, the families are entitled to a lump sum of £2,200 to pay towards their funeral, but this must be claimed within 3 months of them passing away. As I mentioned, my colleague Lisa Booth, she works half a week for ourselves and half a week for Mesothelioma UK, and she's the Specialist Armed Forces Welfare Advisor. So she works really closely with this cohort of patients that were in the armed forces, and she makes sure that they get everything that they're entitled to, and swiftly. So she has a really good relationship with Veterans UK, and often we get referrals from solicitors where people have been in contact with the solicitor because they think that they're entitled to compensation when they're not, and Lisa then ensures that they receive these payments. So I touched on compensation there when I mentioned Veterans UK, and just to go back to patients that were exposed to asbestos as civilians, the majority of these will be entitled to seek compensation, and most of them claim from their previous employer or their insurer. It doesn't matter if law firm, beg your pardon, it doesn't matter if the company that somebody worked for is no longer in existence. The solicitors will trace the insurer. And it's also possible to bring claims if there's environmental exposure, or washing overalls, or living near an asbestos factory, for example. So we have a panel of solicitors here at HASAG, and there's some certain criteria that they need to fit to be on our list of solicitors, and I've just listed those off there. There's no upfront fees, no cost to patients and their families. They must receive 100% of the compensation, and they specialise in this area. And just to go back to the top point there, they must offer home visits, but obviously that's not possible at the moment. And I know that all the law firms that we work with, and the ones that we know of locally, are all doing the same. They're working really hard to continue with the compensation claims regardless of COVID-19, and we're all trying to find new and innovative ways to make sure that we can continue to support our patients. One other scheme that's now available to patients shortly after diagnosis is if they're unable to trace the insurer of the company that they previously worked for. If that no longer exists, then there's a scheme called the Diffuse Mesothelioma Payment Scheme, and that pays out on average a lump sum of £122,000 to those people who can't get compensation through an insurer. But I would always suggest that patients don't try and claim this themselves. As part of the Asbestos Victim Support Group Forum, we have people on the Oversight Committee, and we're told that those who claim themselves have a higher turn-down rate than those who use a solicitor. So I've listed the amounts there down the side. So for example, if somebody was 62 when they were diagnosed, couldn't trace their insurer, they would receive a gross lump sum of £190,135. There are deductions from that. The benefits that they've already received would be deducted, and the solicitor is entitled to take up to £7,000 from those payments. But I would always urge a patient to speak to a solicitor first and get them to help them to do that. The other thing that we help patients and their families with is the coronial system. So it's a difficult conversation to be had with a patient after diagnosis, but it's an important one. And sadly, when somebody passes away from any type of asbestos-related disease, this has to be reported to the coroner. When somebody passes away from an asbestos-related disease, it's classed as an unnatural death, and all of those will need to be investigated from the coroner. And we help the patients' families through this system. We give details of somebody's employment, their work history, their exposure to asbestos, and we're able to share that information with a coroner. When a patient has signed the information, that's good enough for the coroner to use for an inquest. So to summarise everything that we've discussed today, we want to make sure that every patient that's diagnosed with mesothelioma, providing that the exposure is not outside the UK, will get a lump sum of some kind, so we would identify exactly where the entitlement would be. We always make sure that patients receive their payments quickly and make sure that they're not worse off if they're receiving other types of mean tested benefits. We always refer newly diagnosed patients to the Asbestos Victim Support Group Forum to ensure that they are aware of all of the campaigning that we do, and that support groups will identify any exposure and signpost to other services like occupational therapy, solicitors, or refer them back to their lung cancer nurse specialist or their mesothelioma nurse specialist. So just so that everybody knows that all patients are diagnosed with mesothelioma are entitled to something, regardless of their finances, savings, or their age. It's really important to get that information out. Thank you very much, and happy to have any questions at all.
Thank you, Lynne. Thank you, Lynne, for telling us all of the fantastic things that HASAG do, and I'm sure people listening will agree and joining me to thank you and your team for everything that you're doing for asbestos disease sufferers, particularly now during lockdown and the unusual times we find ourselves in. I mean, you only have to look at all the positive messages on social media about you and the team, and it's, you know, the need is there and you're fulfilling it. That's brilliant. It must be so hard for the people that need your help at the moment, and you've touched upon the things that you're doing to help, but I just wonder if there's if you can tell us a little bit more about what you're doing to support people's mental health during this period.
Okay, so we are offering Zoom coffee mornings. We've had 4 of those so far, because we have 4 different support groups usually around the region. One's usually in Uckfield, one in Portsmouth, one in Southampton, and one in Woking. And we're trying to stay in touch with those by having a Zoom coffee morning, and they've gone really, really well. We've had nurses, solicitors, other healthcare professionals there to just try and prevent some kind of isolation. And we're also just about to launch our counselling service. So over the last couple of weeks, we've been interviewing counsellors to have a panel so that we can refer patients and their families. It's not just for their patients, but also for their families who are struggling with the diagnosis, and the fact that they're shielding at the moment and they're scared to go to hospital to have chemotherapy and other types of treatment, and the fact that most of the trials are on hold. So to just try and prevent that isolation. So if we identify somebody, or somebody approaches us to say that they're really struggling, we're going to have a list of counsellors, and they can give one a call and talk to them like we're talking now, or over the phone, and then hopefully fairly soon we'll be able to see them face to face. And we're going to be funding that ourselves for up to 6 sessions and onwards, if we feel that it's going to be beneficial to those people that are really in need.
That's brilliant. Thank you. Thanks, Lynne, ever so much for sharing your time with us today and for telling us about the role of support groups and what HASAG are doing. Thank you.
Thank you very much.